Good afternoon, everybody. My name is Robin Rushing, and today we're going to be talking about ventilator weaning in the patient with traumatic brain injury. First item up, we'll give a couple of definitions, and I'm sure most of you are quite familiar with these. But traumatic brain injury, the definition and classification that we will use is damage to the brain resulting from an external mechanical force with brain function temporarily or permanently impaired. The Glasgow Coma Scale is a scoring mechanism utilized to determine classification of the injury and probability of success for the weaning process. For those cases that we treat at our facility here in Wisconsin, the initial Glasgow Coma Scale for most of our patients is 3 to 8. By the time we bring them in and get them thoroughly into the weaning process at the long-term acute care facility, it is generally somewhere between 9 and 12. Our goals for today and our goals in the cases that we treat here are improving outcomes for patients with traumatic brain injury who are mechanically ventilated and transferred to a long-term acute care or inpatient rehabilitation facility. So these are patients with traumatic brain injury who have already been through their initial course, the initial injury at the acute care centers, usually through their surgical processes, maybe not all of them, but the predominant portions of those, and are still having medical and neurologic complications. Our primary goal now becomes life support, again, the ventilator piece of that, the ventilator weaning, with medical stabilization, rehabilitation, and optimum discharge planning to a home environment. That is the ultimate goal. We hope to be able to acclimate our patients in this particular environment.